Ga kashi inda yara ke kashi kenan.
It's the wellhead that houses the submersible pump, which helps pump water into the reservoir up. The pump has been stolen.
Getting water for their own personal hygiene is a challenge, not talk more of how to store this water so that they take care of themselves during their menstrual days.
This violence is happening and a lot of them are not reporting. So we hope that at the end of this project, women and girls will be able to open up if and at any time they are exposed to any form of violence.
Malnutrition situation in Northeast has lingered for over 11 years and counting. And this has put a lot of households in a very severe malnourished situation.
Through this response, funded by the NHF, JDF will be supporting 7,500 women, men, boys and girls, including persons with disability.
Communities that are hard to reach due to bad roads, insurgency, lack of government presence, etc. are places Nigeria Foundation loves to go. The reason why JDF does this is simple and can be found in the vision statement, which envisions a society where the poor and vulnerable can have access to social justice and sustainable livelihood. In over the 20 years of our existence, JDF has worked with several key humanitarian actors and development partners in various intervention projects and programs for single mothers and their children, persons living with HIV/AIDS, orphans and vulnerable children, young people who lack direction, displaced persons due to natural and man-made causes, as well as advocating for policies that benefit these target groups. JDF's work has been so impactful that currently JDF is in strategic partnership with the Nigerian Humanitarian Fund, managed by the UN Office for the Coordination of Humanitarian Affairs.
JDF, as a women-led national non-governmental organization, is keen on building strategic partnerships and working with other agencies as part of efforts to ensure that we meet the most vulnerable wherever we work. And the major reason why we came on board as partners of the Nigerian Humanitarian Fund is on the basis of that, and JDF had to undergo a very rigorous due diligence process, which we scaled through in the year of 2018, and since then we have continued to draw funding from the pool funds of the Nigerian Humanitarian Fund through competitive processes over the years.
13 years on, the conflict in Nigeria's northeast states of Borno, Adamawa and Yobe continues unabated. The impact of the conflict in the Bay States, home of 16 million people, has created a protracted humanitarian and protection crisis affecting millions of people. There are an estimated 8.3 million people in need of humanitarian and protection assistance across the Bay States, of whom 2 million are internally displaced. 2.4 million of these are in acute need. Women and girls are at a disproportionate risk of gender-based violence, including domestic violence, trafficking, including forced and child marriage, sexual exploitation and abuse, and neglect. In 2023, Nigeria Foundation and the Nigerian Humanitarian Fund is aiming to provide life-saving aid to the affected people in water, sanitation and hygiene, nutrition and protection sectors in northeast Nigeria.
Trade is responding to the water, sanitation and hygiene needs of persons affected by crisis in Mafa local government area of Borno State and Unisari local government area of Yobe State. Through this response, funded by the NHF, JDF will be supporting 7,500 women, men, boys and girls, including persons with disability affected by the crisis that has ravaged the region 13 years and counting.
Before JDF commences any implementation program in a community, one of the first approaches during community entry is to meet with the traditional leaders. Simari is a host community in Mafa local government area of Borno State that accommodates people who have fled their homes from other places. One of the major needs here is having access to potable drinking water.
One of
the major challenges we are facing is access to clean water.
Although in 2022, a borehole was rehabilitated in Simari by JDF with funding from the NHF. Though the borehole is fully functional, however, due to the high population of people living here, there is still need for more boreholes to cater for the high demand of clean water. This is Gwagwagwap ward in Simari community. A borehole was dug here before. Sadly, the site was vandalized and pumping machine stolen.
This is a water facility that was constructed by ZOA. At full capacity, this facility is supposed to pump about 40 cubic meters of water, which can confidently serve 2,000 individuals. But sadly, because it's non-functional, it is used as a shelter for people to sit down and relax. So it actually caused a serious water gap for the people of this community. You can see this is the wellhead that houses the submersible pump, which helps pump water into the reservoir up. Here you can see how the cap that protects the well has been damaged in the process of vandalizing. So the pump has been stolen, and you can see it has been exposed. So this is a major issue, as it is the source of power that pumps water actually up to the reservoir. So it has been a serious challenge, but JDF has actually taken time to do an assessment of all the remedial items and the cost of work and everything required to fix. So it's a planned activity, and all things being equal, this week work is going to commence.
Ana saya dai, ana sha wahala, ana saya hakan ma babu ma ana saya ma sai an sha wahala tukuna. Za su sayo yanzu ga tambaya mu da masu na ta naira 150 to kullum muna sha wahala. To shine Allah sa ya taimake mu da wuri wannan aikin abu yana bohol gyara mana jama'a sun sha wahala. Allah ya taimake mu.
Borehole rehabilitation is not the only activity Gyredo Foundation will be carrying out in Simari.
So JDF is offering a complete package, because it is one thing to provide water and then people do not have access to items. So water, sanitation and hygiene are strongly interlinked, such that when you provide two and one component is lacking, it do not give the desired result.
Girki, ka wanke hannunka, yaro ya kashi, ka wanke yaro ma, ka wanke hannunka da sabulu.
As you can see, this is a household where it consists of the men, women, and adolescent girls. This very household has a man and his wife with 3 adolescent girls and 1 son. They only have a latrine here, which is not an improved latrine. They just constructed it with blocks. And then the next household has 2 men, 2 women, and their children, very young children. So the issue here is that these adolescent girls do not know how to take care of themselves, especially using this very limited facility, and the fact that they do not have water. They have a water point here, but it has been vandalized, and getting water for their own personal hygiene is a challenge, not talking of how to store this water so that they take care of themselves during their menstrual days.
A zamana na budurwa ba na samun abin da zan yi amfani da shi wajen ganin al'ada.
Polio ya kwandi yara yana, shawul ya kwandi yara yana, jarkal ya kwandi yara yana, lema bana muradin yana ne.
ADF has engaged some community hygiene promoters to ensure smooth implementation.
Idan muna zuwa gida-gida ko muna focus group ma 'yan mata, muna musu bayani akan menstrual hygiene management a yayin da suke ganin jinin al'adarsu. So idan 'yan matan da basu fara yi ne, muna gaya musu yayin da za su fara gani, za su iya fara ganin abu kaza zai iya zuwa musu a wata. So kar su ji tsoro, abin normal kowa yana yi, ya zama kowane mace sai ya yi. Idan ya zo musu ba za su ji tsoro ba, ga matakin da ya kamata su bi. Idan ko suna da ya koma ma za su je su gaya mata, kuma ma mu gaya musu idan ya zo ga ta yadda su tare shi.
Muna shiga gida-gida muna tunatarwa akan tsafta da yadda za mu kula da muhallinmu da kanmu da ruwanmu da abincinmu da kuma 'ya'yanmu gaba ɗaya.
Muzungu is another community in Yunusari local government area of Yobe state that JDF shall be rehabilitating the non-functional borehole. This borehole, according to some community members, was serving over 1,000 households daily.
Their taps are not functioning. They actually have tap heads, but there's no water. We need to rehabilitate this so they'll get access to this water and reticulate if possible. You could see that women come all the way from the hospital just to get water, and they carry this water in an open basin, which is easy for the water to get contaminated at different points.
A gari mun tayi da safe mun tayi kafin karfe 10 ba zai wuce sa'a uku ba zai wuce jarka uku ba abin da za mu sai mun je jejin mun ɗebo ruwa.
Mu ba mu da ban ɗaki ma, yara in sun yi kahi sai dai mu kwahe mu kai mu zubar a jeji.
Manya fa, like fada.
Zuwa za mu jejin mu yi mu dawo.
This harmful practice, if not addressed, can lead to high cases of cholera, typhoid, malaria, and many other ailments. According to UNICEF's November 2022 report, more than 100,000 children under the age of 5 die each year due to diarrhea, of which 90% is directly attributable to unsafe water and sanitation. This is why our Wash Comes officers will help deliver hygiene promotion messages to community.
Ji daɗin zuwan JDF a Mazogo saboda muna so a hana yin open defecation ɗin kwata-kwata a Mazogo.
WASH isn't the only project that JDF is implementing with support from NHF. The nutrition sector is another key project.
Malnutrition situation in the Northeast has lingered for over 11 years and counting, and this has put a lot of households in a very severe malnourished situation. A lot of caregivers are still giving birth, and especially in hard-to-reach areas in the Northeast, we have high level of acute malnutrition, considering the fact that most of the livelihoods of the caregivers or households are being disrupted due to the insurgency that have lingered for this long.
In Yobe State, JDF shall be carrying out nutritional services in 4 local government areas, namely Tamurwa, Machina, Yusufari, and Jakusko.
Some of these communities that live here in Jakusko, like when we talk of this, in particular Zabudu Ndachia, we have so many communities that are far from here. Some of them, their walking distance is up to 2 hours before they get to the nutrition status. But thank God for JDF will be able to reach out to these communities to bring these services closer to them so that they'll be able to access it. And some of them, due to financial status, they can't be able to access all these services.
The children used to go under some amount cases, some that is severe acute malnutrition and moderate acute malnutrition. The severe acute malnutrition, we help and give them the RUTF, which is ready to use therapeutic food supplied by UNICEF, which the MAM cases, that is the moderate acute malnutrition, we support them with Action Meal, which is being produced by JDF with the intervention of the NHF.
One of the fundamental principles guiding JDF's nutrition projects is the active involvement and ownership of the communities. Recognizing that local communities possess valuable knowledge and capabilities, JDF has empowered them to play a central role in the project implementation.
What we call community entrance. First of all, we meet the bulamas, where the heads to talk to them, because first of all, you need to talk with the Bulama so that be able to sensitize their people, to be able to know our aim and targets, why we want to implement in the community, and then the nutritional status of their children. So in which make it easier for us to be able to assess the caregivers in the various community.
JDF's Nutrition Intervention Program is focused on ascertaining the nutritional status of children through the usage of middle upper arm circumference tape and the treatment of both moderate acute malnutrition and severe acute malnutrition cases within the project communities using locally formulated food.
So in this project to scale up access to treatment for acute malnutrition for children under 5 and pregnant and lactating women, JDF will be implementing the projects in Tamwa, LGA, Yusufari, Jakusko, and Machina, LGA of Yobe State, in close collaboration with the Primary Healthcare Center. On the project, JDF is intending to reach 2,000 children severely acute malnourished, 4,000 children with what we call action meal, moderately acute malnourished, PLW, pregnant and lactating women, 1,600 on the project. JDF is also intending to, in collaboration with the Primary Healthcare Center, provide 8,000 children with micronutrient powder. And we're also intending to reach 3,000 caregivers with hygiene kits, considering the fact that we're working with, we're having a multi-sectorial intervention.
Through a holistic approach that combines therapeutic feeding, health education, and counseling, JDF shall be improving the health and well-being of malnourished, pregnant, and lactating mothers and their children in Yobe State.
We are doing an action meal intervention which has to do with our corn, soya beans based branded JDF products, where we reach out to the women to help them gain stability and also to be healthy. And then apart from that we also have a program that we call the cooking demonstration. This is basically a program where we teach the women how to use what is within their vicinity and how to cook it and live a healthy life, because most of them feel to think that if anything doesn't come from outside, then it's not going to be healthy. Meanwhile, they have a lot of nutritional, healthy things around them that they can make use of. So those are some of the things that we are here to teach them and also enlighten them about too.
Collaborating with local health facilities in communities where JDF shall be implementing is an approach adopted in order to ensure smooth implementation. Abubakar Ibrahim, a health worker in Gogaram Primary Healthcare Center, is one of the focal community persons JDF shall be working with. He shares more light on the different malnourished cases that will be catered for in this nutrition project.
I'm on integrated management of acute malnutrition. So ta kunshi ababuwa da yawa tunda tana da rishe-rishe. Shine yanzu misali muna aikin SAM, severe acute malnutrition, na yara from 6 months to 59 months. Then muna aikin MAM cases. MAM cases nan kuma muna aikin from 6 months to 59 months in children kenan. Sannan muna amfani da pregnant mothers wanda muwag nasu less than 19 centimeter. From 19 centimeter downward muna gwada mid-arm circumference nasu na waɗannan matan. Sannan sai lactation mothers su ma mukan ɗauki wannan muwag ɗin. Lactation mothers, that is 0 to 6 months of breastfeeding, mukan ɗauki wannan mukan ba su. So waɗannan su ne irin ababuwan da muke yi da JDF.
Go to the house, who goes to the field, that is into the community, to house screening. They screen the children, that is 6 to 59 months. When they identify that those children are malnourished, that is in the MUAC tape, they now refer them to the OTP site. And the OTP site is being run every Wednesday. Weekly, it's a weekly activity. It's run every Wednesday. So they do come to the OTP site for further screening and treatment.
The third project that JDF and the NHF are in partnership on is the protection sector in collaboration with Care Nigeria. Protection is one of Gyredo Foundation's strong areas of interventions. The protection coordinator tells us more.
Jaido Foundation, JDF, is currently implementing a protection project in Yobe State, Gashua Abadi precisely. We are implementing in partnership with Care International with funding from the Nigerian Humanitarian Fund, NHF. This partnership came about because of the needs we saw in our area of implementation for these beneficiaries, especially women and girls who have been exposed to insurgency crisis in the Northeast, which has lingered up until this time. Women and girls have been exposed to a lot of protection needs and concern. You see, women and girls' mental health have been one way or the other exposed to harm and dangers that their health shouldn't be exposed to. Women and girls have been exposed to other protection concerns such as domestic violence, such as rape, such as sexual assault.
Finding themselves in this situation of them being a survivor of GVV. We try to help them by giving them counseling and also trying to case manage them, and also try to give them psychosocial support, skill acquisition, and also we try to help them to know how to read and write on their own in order for them to help themselves. We also try to empower some of them in order for them to have something doing while we are not there to support themselves in the situation they find themselves.
The protection project that we are currently implementing in Yobe State covers both the response and the prevention aspect of protection. For the prevention part, we do awareness and sensitization across the communities of implementation. And also for the response part, we have a safe space for women and girls. In this safe space, women and girls come in to interact, they come in to socialize, they come in to also learn. And because in this safe space, we do sensitization for these women on gender-based violence. We also do sensitization on other aspects that covers human rights, that also covers women's rights. And also we do sensitization on nutrition for their children and household. We also do hygiene promotion activities. We also do PSS. We do counseling, we do group counseling, we do individual counseling. And then we also do other recreational activities in the safe space like games, traditional songs, dancing, depending on what is allowed in the setting where we are implementing.
At the end of this project, here are the things JDF hopes to achieve.
While working with funding from the NHF, we receive mentorship, we receive guidance, we receive through spot checks, we are able to check the gaps we have in our systems and strengthen them. And so for us, it's very important for us as an organization, and we do not take this partnership for granted.
By the end of the project, it will be fair to say that for the past 3 years, every year there is a cholera outbreak declared in the base states of Adamawa, Borno, and Yobe. So the aim is to mitigate, to prevent an outbreak, and should there be an outbreak, to mitigate the widespread of an outbreak. Like I mentioned earlier, the aim of any WASH response is to prevent the disease rates that are associated with water sanitation and hygiene related issues or waterborne disease. So at the end of the day, NHF and JDF will be happy to share that in locations of implementations, there was no case of a cholera outbreak or a water related disease, or if there was a case, the consequences or the aftermath of the outbreak were not as severe compared to other locations, just for the fact that there was a water sanitation and hygiene response in such a location.
We hope that women and girls would understand and know what gender-based violence is. And we also encourage them, because we know that gender-based violence is happening and a lot of them are not reporting. So we hope that at the end of this project, women and girls will be able to open up if and at any time they are exposed to any form of violence, and then also guide them on where to report. Peradventure we are out of that community, what they need to do, where they need to report, and then we just hope that generally they'll be informed about what violence is.
JDF on this project will be reaching 2,000 children with severely acute malnutrition. JDF will also be reaching 4,000 children that are moderately acute malnourished. on the same project, JDF will be reaching 1,600 women.
As you can see, the color of the water, it's very beautiful on the eye. It encourages people to take the water. This facility was rehabilitated by JDF, funded by the Nigeria Humanitarian Fund, NHF, on the 2022-2023 WASH project. Before now, these people were having water shortages that it was a challenge for them to get good water. As you can see, the water has been installed with a chlorine feeder to also promote and improve the quality of the water.
This borehole has a chlorine feeder. A chlorine feeder has been installed on this borehole, which chlorine is being put inside. And the essence of this chlorine in water, chlorine helps to disinfect water, and at the same time, it helps to prevent incoming contamination that will come from external source.
So it's not just about the quantity, it is also about the quality of the water. So this borehole, as you can see, can support at least 900 persons in a day, with water of at least 15 liters per person.
Bohol da mutane suke amfani sun kai mutum 1000 da wani abu. A damar garin gaba daya suna amfani da shi.
It runs 7 to 8 hours in a day, powered by solar system, and is dependent on daily solar installation. It means that on a very sunny day, it is going to have higher output on less sunny days or cloudy days. The people are happy. As you can see, they have access to water throughout the day.
Mama Multum Umara used to store water in very open containers and her clay pot, which did not have a cover, and the water used to be turbid, but now she has clean water. As you can see, her containers are covered and she fetches water from the borehole now.
We looked into Simari and we found there are gaps in their water collection system, water purification, in their personal hygiene, their food hygiene. So when I decided to come and bring awareness, that's through hygiene promotion in Simari, in order to alleviate all those ailments and also to be able to help the health status of the individuals in Simari.
To kafin za a zo a gyara mana wannan famfon bohol, kafin za a gyara mana muna shata wahala, kafin za su gyara an zo an gyara gashi na a cikin kashi 190 mun samu sauki. Mutane gashi na hanci uku ana diba ruwa mutum kusan 170 kowane hanci. Kullum muna saya da ruwa trip 150-200 yanzu ko na naira ba ma saya.
To JDF ne ta yi supplying ɗin machines ɗin nan da kuke gani guda 12 da tebur ɗaya da kuma materials ɗin da za a yi part ɗin. Dama wanda suka iya ɗinki aka zaɓa saboda kamar trainers of trainers ne. Saboda sun iya an zaɓe su sun yi domin su je su koya ma wa'yansu su ma a cikin gari ɗin. Su wa'yannan in sun gama wa'yansu ma su iya zuwa su ba wa'yannan za su ƙara koya ma wa'yansu domin da a samu ci gaba a samu ƙaruwan juna kuma mata su samu sana'a yi a cikin garin Mazobi.
JDF ce ta koya mana wannan abin kuma za mu ɗauke shi a matsayin sana'a, wani ya zo ma za mu iya koya mai kuma za mu iya saida amma mu yi amfani da kuɗin haka dai.
Yana taimaka mana sosai gaskiya don saboda ba ma jefarwa za mu iya wankewa mu ƙara yin amfani da shi.
tabbas al'umma suna ganin mahimmancin aikin da muke. Dalili ko shine a da akan samu kwalara outbreak, amma yanzu abin yana raguwa sosai saboda kwalara ana samun ta ne ta hanyar gurɓataccen ruwa, amma yanzu kuma alhamdulillahi sukan yaba mana ta cewa ciwon ciki da suke samu a gida da sauran abubuwa yanzu babu shi.
A wajen da ana yin kashi da bayan gida kafin GDF ta zo, amma yanzu da GDF ta zo mun shiga gida mun faɗakar a daina yin kashi a guraren nan. Yanzu an daina yin, sun koma cikin gari suna yin bayan gida.
Mun yi daɗi, mun yi murna sosai.
Godiya ne zan yi musu ta musamman, mun gode musu sosai, gaskiya sun tallafa ma mutanen gurin, musamman ma a wajen aikinmu. Zan ɗauko magana dangane da abin da ya danganci RI, alluran da muke ma yara. Da muna da low turn out na RI, amma a gaskiya dangane da JDF ta zo nan, don karban abincin nan matan suna zuwa suna kawo yara suna karban immunization sosai yadda ya kamata. Saboda haka mun gode musu sosai, kuma muna abin da muke bukata kuma su zo su kara mana wani abu daban, kar su bar mu gaba da.
Fara rashin lafiya ne da zazzabi da kashi haka ya fara yi, to sai na kawo shi tamuwa. Da na kawo shi tamuwa kuma sai aka fara bamu ana bamu kawai sai na ga ya fara warwarewa, yana yin lafiya sosai, har so dai lokacin da aka sallame mu suka ce ya ishe shi tamuwan. Gaskiya na ga canji sosai.
Abin da zan gaya muku, wannan mudan da muke karba kafin a kawo mana din muna tare da matsala, amma yanzu da ana bamu gaskiya ya biya mana bukata, ya mana wadata akan in mun sha ba mu da yunwa kuma yaran mu ba su da yunwa. Yana sauke mana nono garanti, kuma mun ji daɗinsa sosai, mun yi farin ciki. Yanzu da aka ɗauke har an ɗan sa mana kewa ma, ko gobe za a maido muna so a kawo mana.
We are here for community closeout, project closeout meeting. So we are here to meet key stakeholders to find out how far they've benefited from the project, how it has impacted their lives, the lives of mostly children under 5, pregnant and lactating mothers.
Tallafin da muka kawo tun shekarar da na bara yanzu ya zo ga karshe. Kowane tallafi dama akwai lokaci da ake yin sa, yanzu kuma gashi ya zo ga karshe.
Da fari yaran nan mai dan ga sun bambanta da lokacin da ku zo ku fara wannan aikin, amma da aka fara wannan aikin gaskiya mun cimma buri sosai.
Mun gode.
A ƙara musu garin haka suka ce. A ƙara musu garin na a ƙara musu, yana taimaka musu sosai.
So far, the project has been progressively impactful. We have seen significant reduction in the rate of malnutrition in this particular community from when the project started till now. Even for the case of some with medical complications and children are severely malnourished, the cases have reduced significantly from when we started till now. And this reduction in trend has shown that the project has really been impactful, most especially because of our MAM treatments. So the MAM treatments, which is moderately acute malnourished children, treatment for MAM has helped reduce the level of children that become severely malnourished.
Kun ga kina zuba haka kaɗan kina gauraya har kina zuba shi haka.
godiya kawai za mu musu, mun musu godiya. Madalla Allah ya ƙara. Mun musu godiya sosai.
Mun gode, gaskiya mun musu godiya. Mun gode sosai.
Mun gode sosai ba kaɗan ba, mun gode. Mun yi farin ciki kuma. Mun gode mun ƙara godiya kuma har yanzu muna daɗa godiya. Ko lambar su kuka ba mu ma za mu iya yi musu godiya sosai ba kaɗan ba saboda mun ji daɗin su.
JDF, whose mission is to reach out to the undeserved, is hopeful that through this partnership with the NHF, is able to create sustainable livelihood and access to basic health information to thousands of vulnerable people in Borno and Yobe states. After all, JDF gives voice to the voiceless.
JDF!